What's up, treatment group? My name is Dr. Joey Nardone, and I'm here to talk about my friend Buck O'Brien, who is a 36-year-old Irish fireman. I had one sole differential diagnosis for Buck, and it was post-traumatic stress disorder, and it was ruled in because all criteria were met. And the primary diagnostic criteria is that the client directly experienced the traumatic event that left his body covered in burns, and he's been having spontaneous memories, consistent nightmares, and flashbacks for the last 8 months. His story starts 8 months ago. He was going on a regular fire rescue, and he went into a burning building by himself, which he's not supposed to do, and he had burning beams fall on him and got severely burned all over his body. He went to the burn unit for a month, and all the nurses said that he was very stoic and strong and held together, and that he had a mask on, and that he seemed like he was fine. But he's came to me today now because he has had dreams since back then, reoccurring dreams where he wakes up with the beams on him, and he's been having a rough time. He's married, and he has trouble going to bed sometimes because he knows that his nightmares are going to wake him in the middle of the night, and he's going to end up waking up his wife. He has avoided work and has not been back to work since this accident. He's avoided work or anything dangerous to avoid being triggered. He views himself negatively since the accident, saying things like nobody will want to work with me, since he set a bad example to the younger firemen because he teaches them not to enter a burning building alone, and he did it himself. He often wonders if life is worth living. He quit softball and homeless shelter volunteer work because he became such a anxiety-filled homebody who avoided a lot of social interactions because he thought lowly of himself. And before this, he had a distinguished career and was very well respected, and nobody says he isn't anymore, but he still feels as if everybody's looking down on him. He can't sleep at night. He drinks to calm his nerves and to soothe him so he could fall asleep. He can't concentrate at all. His hands are trembling throughout the day, and he's constantly looking around the room, checking for danger because he's always on edge. It's been 8 months, so the criteria was met for it being longer than 1 month because it's been a long time. It affects his everyday life. He hasn't been able to go to work. He stays home all the time. It's affecting his marriage. And none of this was due to any other drug abuse or mental disorder. And our multi-axial diagnosis for axis 1 was post-traumatic stress disorder. Axis 2 was none. Axis 3 was none. And axis 4 is that he was involved in a fire accident with great bodily harm. And our GAF score was 50. And for the theoretical perspectives, for the behavioral perspective, Buck experienced a traumatic event that caused him great stress and anxiety. The accident that left him with burns set up some reinforcements and behavior that would fit the behavioral perspective. He avoided stressors and triggers by not returning to work, which would be an example of operant conditioning with negative reinforcement because he was avoiding the triggers. And the stimuli would be his job and dangerous fire situations and anything that would recreate or mimic the traumatic event. And for the cognitive perspective, the client has a reason to be traumatically scarred due to his accident, but it impacted his thought process way farther than that. In his everyday life, he looked at himself as lower, debated if life was worth living, and was always on edge and looking out for danger due to his heightened sense of fear, as well as his thought about life and if it's worth living, and he has developed a sense of helplessness. So that is all for Buck O'Brien. Thank y'all. Have a good night.